Good evening. I also want to thank someone. I'm going to thank Tom Hall, because there was so much going on around education here. It was impossible for me to be everywhere, and Tom was very helpful. What I'm going to do, these are my slides. I'm not as efficient as Ann, is I'm going to just take you through some themes that Tom and I discovered as we wandered around this beautiful campus the last 2 days. The first is that demand in global health remains high, and you don't need me to tell you that. You're here. 850 people showed up. Joe Kolars gave a presentation this afternoon where medical student involvement is going up like this every year in international experiences. And so we need to recognize that this is in fact a growing field, and that has real implications for how you think about educational programs. The second is we're still defining global health. We're not sure what we're talking about. And so there were a number of presentations on core competencies and what do we mean and how do we define our programs. And that also, I think, has real challenges but also opportunities as we go forward in terms of what we mean about educational programs. The third, and this was one of the most exciting for me, is that the line between teachers and learners is blurring. And so that sometimes it's people in the north teaching people in the south, sometimes it's people in the south teaching people in the north, south, faculty, students, faculty, students, and I think that's very, very exciting. But it also represents some challenges for a system that has traditionally been very hierarchical. Technology is changing where we teach, how we teach, what we teach, and it can happen anywhere. So I was talking to a PhD student who presented a poster on an epidemiology program Columbia is doing in Zanzibar, where they're training physicians and other healthcare workers in surveillance, and these doctors and nurses aren't even in the classrooms in the Zanzibar. So they might be in clinics, they're somewhere else, and they plug into a 3G. I don't even know what a 3G is, but they plug into this, and all of a sudden they're getting a lecture from Columbia. And that is just incredibly exciting. We heard a presentation this afternoon from Provost Lee of Tufts University about this system called TUSK, and they have an elephant as their symbol, but it's essentially an open platform that allows you to share and create educational content anywhere in the world. Isn't that incredibly powerful? The next thing I learned is that learning needs to be grounded in real-world issues. And so we sometimes get a little theoretical, but that if our learning does not match the needs of the learners, then we don't really seem to accomplish what we hoped we had accomplished. Another thing that I found out was that we can take advantage of our previous experience. So I read a poster about, from the University of California, San Francisco, where for years and years they've been training doctors all around the world in how to do HIV care, and now they're doing it in mental health. And they're taking the same program and all the things they learned to do HIV care around the world, and they're saying, let's apply this to mental health. So they're taking advantage of all that they had to do. I learned that focus remains important. And so another student was telling me about a nurse practitioner program that they have in Mozambique, where these nurse practitioners are being asked to learn about HIV, they're being asked to learn about tuberculosis, they're being asked to learn about mother-child nutrition, they're being asked to learn about everything except what they have to do, which is basically their job. And so as we think about our educational programs and we think about what it is we're trying to teach, we have to keep that focus intact. I learned that despite all the wonderful things that are happening in technology, it does not need to be high-tech or expensive to be innovative, good, or have real impact. And I think that's important for us to remember as we get caught up in this. There was a presentation this afternoon where basically what the chairman of medicine did, I'm blanking on his name, he went out and he bought a sheet for $20 from Macy's. He hangs up the sheet, he stands in front of the sheet and he videotapes himself. It's called a green screen, and then he overlays images, and he's on the moon, or he's doing a Beach Boys video or something like that. But you can do these innovative things and you don't have to spend lots of money or involve lots of high tech to make it happen. I learned that we need to coordinate locally as much as we do globally, and so Madeline from Cornell Medical School talked about this program they have in New York State, where they're just trying to get the 13 medical schools in New York State to talk to each other and get on the same page around global health, along with the 7 dental schools, or however it may, and the 7 schools of public health. And so, you know, it's not just sort of building all these links here and there, it's that we need to build the links among ourselves locally as well. And then this morning I learned that mentorship and supportive supervision remain incredibly important, that we will not get around the people factor and we need to keep that involved. What does this all mean for the future? I'm not entirely sure, but I'll talk a little bit more about Montreal, and I'll hope that later on, and I'll hope that you come there and help me figure it out. Thank you very much.